Hello, everyone, and a very warm welcome today to the UK-India Diabetic Foot Foundation launch. We believe that this is the right step for the diabetic foot, and thus we are using the term CADAM. We believe that multidisciplinary care is the best approach to reducing amputations in the diabetic foot. And we know that my colleague, Professor Vinu Kavathapu, has been developing the work of this foundation over the last 3 years. And it's a great pleasure now to hand over to him to tell you how the process will work.
Good morning, good evening to everyone. Thank you for joining the official launch of the UK-India Diabetic Foot Foundation. And this is to help the clinicians in India that manage diabetic foot patients for access to multidisciplinary diabetic foot advice. So the process the clinicians can follow is when the clinicians encounters a patient that would benefit from an MDT input advice, we are creating a specific digital platform that allows the clinicians upload the patient profile, anonymized, whether photographs or investigation results or clinical material, and that will be made accessible to the multidisciplinary team that provides the advice remotely. So the clinician can choose a video MDT session with the MDT team at a time that is most suitable for the clinician. And the UKIDFF MDT panel will go through the clinical material beforehand and also with the clinician at the time of the video consultation and provide a virtual video consultation joint opinion on the management of that particular patient. And we like to remind service that this is an opinion only based on the information provided by the clinicians, and the final decision will still be taken by the clinician on the appropriate patient's treatment. The MDT advice may range from a simple recommendation on further investigations, or the medical treatment, or a surgical procedure, or a combination of these. And the referent clinician will also have an option to record on the digital platform the action taken by the clinician based on the recommendation. And the clinician will also have an option to record the clinical outcome of the patient and upload the relevant clinical material on the digital platform. So this wider range digital platform is under development at present. But meanwhile, Dr. Prashant Vas will explain to us about the role of the committee that oversees the quality and governance of this multidisciplinary team panel structure. And this advice will initially be provided through a standard email and Zoom type digital platform. Thank you very much, Dr. Prashant Vas.
Thank you, Professor Kavathapu. And it's indeed a great privilege to be associated with what I think is truly a great step in improving the outlook of diabetic foot care in India. I'm Dr. Prash Vas, and it's also a personal privilege to be the chair of the clinical steering group of the UK-India Diabetic Foot Foundation. The clinical steering group will be responsible for upholding the values of the foundation and ensuring that we provide high quality governance, but also mentorship to a panel of experts. What we plan to do is have a steering group of about 10 people, all of whom are going to be extremely important key opinion leaders within India and UK in the field of diabetic foot. We'll also, from the clinical steering group, then approach key local opinion leaders within India to ensure we truly have a broad, multidisciplinary and forward-looking clinical team to provide the advice for all the patients that will come on the platform. I now invite Dr. Bal to ask him and request him to speak on what he thinks this initiative truly represents.
Thank you, Dr. Prashant. I think it is a very novel idea. I think it's the first time we have something collaboration for diabetic food between two countries. I don't think it exists anywhere in the world. And I think it's a very great initiative. As all of us know that there are 78 million diabetic patients. So we have 156 million feet to look after. And we have, for example, different subtypes of diabetic foot like Charcot foot and all, which are largely neglected, and the legs are amputated. I think we need to have such an expertise and multidisciplinary team, which is existent in only few locations in India. And this initiative will encourage people to form a multidisciplinary team in all the locations where diabetes patients are treated. So I again thank Dr. Mike Edmonds, Dr. Venu, Dr. Prashant for inviting India to form this foundation, and we would be very happy to collaborate very actively in the foundation and for the purpose of helping many clinicians and, more important, preventing the higher level amputations. Thank you.
Thank you. Now, we would like to request and invite Professor Michael Edmonds to officially launch the website of UKIDFF, please.
Thank you, Venu. It is indeed a great pleasure and an honor to officially open and launch the website of the UK India Diabetic Foot Foundation. And I will mark this launch by quoting from one of our heroes, J.M. Charcot. I will adapt the quote a little, as he said, "Let us keep talking and caring together. It is the best method of treating. And thanks to all our efforts today, the improved outcome that we will give our patients in the future with multidisciplinary care will not be the same as we give them today." And I wish every success to this UK India Diabetic Foot Foundation, and I will hand over for the final words to my colleagues, Professor Venu Kavathapu and Dr. Aaron Bal.
Thank you very much, Professor Edmonds. We are extremely grateful to the Diabetic Foot Society of India for actively partnering with our whole team. And we are looking forward to perhaps much improved clinical outcomes of these vulnerable patients globally through this joint effort.
Yeah, I think Diabetic Foot Society is now 19 years old, and we have always strived to reduce the higher level amputation. We have had this sort of unofficial collaborations in some countries, but they were not formalized at any time. This is the first time I think two countries anywhere in the world are formalizing an association for diabetic foot. And I think DFSI would definitely and very actively participate to help our patients. And I thank Dr. Mike Edmonds, Dr. Venu, Dr. Prashant for initiating this novel program.
Very much. Have a wonderful rest of the meeting.
Thank you.